Phillips, a dedicated community engagement specialist, also running the Center for Empowering Patients and Communities based in Ireland. Jim?
Hi, thank you, Lars, and a huge thank you to the earlier introductions, and thank you for taking the time to centre everyone as well through this short 1 minute of reflective meditation. As a mindfulness teacher, it's always lovely to see that. I guess what I want to do, reflect upon, is picking up some of Cormac's themes in a way. He talked about institutions, and we do have these institutions. We can't get away from that fact, and they can either be a block or they can potentially be an enabler as well. And so what I would like to talk about is a little bit around what we're doing in England, some of the approaches within the National Health Service, and some of the approaches around actually happening in government as well, to really sort of support this transformation and recognise the importance of community and how we actually bring that into health and healthcare. And this is operated under a number of themes, such as transforming the medical model, rethinking medicine, and how do we move on from that 19th, 20th century view of medicine and health and moving much more towards a 21st century model of health and engagement and take it forward as well. So how do we do this? I'd like you to take a moment just to reflect on a couple of things. When we think of our health and well-being, and if maybe we've got a long-term health condition, we might have depression, anxiety, arthritis, multiple sclerosis, diabetes, all sorts. If we take a moment to reflect upon that, what is it what enables us to stay well with those long-term health conditions? You know, what are the factors which actually contribute to that and allow us to stay well? Now, the traditional medical model would immediately say it's a clinician, it's a treatment, it's a drugs, it's a surgery, and everything else. That's what makes us stay well. But in actual fact, when we think about it, what enables us to stay well and have good health and well-being is the quality of the communities we live in, our environment, the actions and the choices we make every single day around what we eat or don't eat, what we drink or don't drink, what we put into our bodies, the exercise we do, the walking we do, how we interact, our worldview, is it a positive worldview? And I love the reflection on gratitude in the introduction. We do a little exercise which is actually on the NHS, called which is a gratitude exercise, where we get people to reflect upon, you know, the positive things in their life rather than the negative. But going back to this, what constitutes health and well-being? When we look at studies, when we look at the evidence, actually only 20% of this comes from traditional healthcare. So if we've got a long-term health condition or something else, only 20% is coming from our healthcare provider as a sort of average, as it were. The rest, like I say, is the decisions and choices we make, our environment, and quite a lot of things in our control and out of our control, and the community that we live in as well. So if we really take that on board, that means if we are going to have healthy communities, healthy societies, healthy individuals, the quality of the communities that we live in and our attitude towards our own health and well-being and how we treat ourselves is just as important as that appointment with the doctor or the GP, if not more so. What people value most as they age and also they accumulate long-term health conditions, what they really miss is things like loss of connections, the things that they value doing in their day-to-day lives. And we also know that what we can do as an individual is also limited as well. We can't have social connections on our own. It doesn't work. Yeah, we need that participation. However solitary we might be in our nature, we also need those connections as well. And we know that social networks promote health by providing access to these social connections and sense of well-being as well. Provides access to information, resources, and participation in community organisations. We know from the evidence it raises people's health status. People feel better. Participation in this sort of thing actually enables us to draw upon our own assets, our own innate ability to solve problems, to work through solutions collectively with other people in a similar situation. And that process actually empowers us to take back control of our own health and our own healthcare as well. It moves us away from being passive. You know, you're the doctor, you tell me what I should do. And when that doesn't work, I blame you, the doctor, to actually thinking through, I'm a partner in my health as an individual, and collectively my community as well. And collectively we can support each other through this. So how do we do this? We've been working on this in the NHS for quite a number of years, actually, and we're actually starting to now develop a bit of a model around this as a recognition of how important communities actually are. To put it quite simply, saving healthcare services a hell of a lot of money as well. I mean, there is a financial implication here, and we can't get away from that. And unfortunately, finance often drives healthcare. So what we know is that we need to enable and empower citizens to develop health literacy, to have the confidence, knowledge and skills to be able to manage their health and well-being based upon what's important to them and their values, not the values and importance dictated by the healthcare system, but based upon what's important to them. But also that the health and social care workforce have the skills and the ability to enter into those conversations with people around what's important to them and what really matters to them, rather than dictating to them what their health outcomes should be. But also then that the health and care systems are what we call co-produced, what we call strategic co-production. So citizens are integral and fundamental to actually co-producing the healthcare systems that we want to see happen. Okay? And that also barriers to universal healthcare are proactively reduced as well. And that communities are empowered to become healthy communities as well. So there's these different elements that we need to be proactively working on as well, so that everyone has the skills and the confidence to work in a partnership way to solve common issues. And in England, we've now actually got formal legislation around involving citizens in the design of healthcare services and training programs to actually empower and enable citizens to have those skills to be able to work in that way as well. And what we start to do now is actually say that, and we've got a whole scheme, what we call social prescribing. So what we're now saying is that in healthcare, everyone has a personalised care support plan where the emotional and psychological and community elements of that care and support plan is given equal status to the clinical interventions as well. And not only that, we have things called community connectors or social prescribing link workers who proactively sit down and work with individuals around what's important to them and what matters to them, and look at how they can connect them to community initiatives and community groups and community things, but also take a role in actually fostering the development of those groups and things as well. So this is everything from garden groups. So we've now got allotments and vegetables growing in GB surgeries, and you'll hear a bit more about that from Ed a bit later. We've got garden groups, walking groups, people going out planting trees and all the rest of it on prescription. You know, almost the same way. So rather than prescribing antibiotics, well, not antibiotics, but antidepressants and painkillers and things, actually supporting people to do things and get back into their lives, things which are meaningful and important, and actually facilitating that and helping that. And through that, what we found is that our institutions are now really recognizing that if we just focus on the biological, traditional medical model of health and well-being, we're just not going to solve all of these issues at all. And there's a real recognition now that unless we address the community issues and community cohesion and everything, we're just not going to get the health and well-being we want to see within our societies and everything. I mean, this raises various issues around funding and money and value for money. And these are the questions government ask and sort of say, well, you know, what's in it for us? You know, so how do we justify spending money on this? Well, what's the return on investment? To give a hard-nosed thing about it. So one of the questions around this is, well, how do we measure it? Is it measurable? You know, institutions like to measure things. They like to quantify things. They like to stick round pegs in square holes and bash them until they fit and everything else. So we have developed measures. We've developed Southampton University, lovely little measure which goes with a snappy title of the collective efficacy of networks. But what this does is actually enables us to really show and demonstrate in an empirical, evidence-based way that actually when people are connected into community networks and they've got strong social networks and feel a sense of social cohesion, they do have better healthcare outcomes. They use healthcare services less, so therefore they also cost less money as well. And that's the argument that we've been making in England within the NHS. It's now got notice, is now a core part of a national strategy and supported through funding and supported through a whole network of people employed specifically to work around that whole area as well. I mean, I have got slides on all of this, which I can show you and references and all the rest of it. But I really just wanted to sort of talk you through a little bit around our vision, the work that we're doing, and really how we're trying to rethink the medical model and transform the medical model away from a purely biomedical model to what we call a psychosocial model of health, where the importance of community, our ability to self-manage, where health literacy, our sense of control over our lives and everything else becomes core to our healthcare and the way we work as well. And I don't think the system has to break to achieve this. I think we can transform the system. It's not going to be quick, but we are doing it and we are seeing the results and we are seeing this happening. So I've got real hope around this and the way forward. And you know, it works. It's as simple as that. It works. We know it works. We've got proof it works. We've got the evidence, and it's brilliant when you see communities coming together in this way to work collectively on health and well-being alongside the individual and alongside the medical as well.